Hello, my name is Angela Trautman. This is my capstone and 5-year plan presentation. Here we have my professional bioskit. I moved to the United States from Colombia in 2007 after selling my local restaurants. Then I obtained an associate degree in nursing at El Paso Community College, and then I work in the state of Florida as a hematology oncology nurse from the past 3 years. Once completing my Bachelor's of Science in Nursing, I plan to join the bone marrow transplant department of my unit where I can provide specialized care for international patients. The first framework is Humanity and Society. Our first baccalaureate degree student learning outcome from the undergraduate student handbook says that we have to practice safe and effective holistic patient-centered care to a variety of patients' clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. I felt I met these learning outcomes by two assignments. The first assignment was the Global Health Presentation PowerPoint. The purpose of this assignment was to gain a better understanding of professional role in a global health. I used the International Transplant Society, which is a non-profit organization created to promote the education and clinical practice excellence of nurses who are interested in and participate in the care of transplant patients. This one was part of the class Nursing 4550, Nursing Leadership and Management. The second assignment I felt helped me to achieve this learning outcome was the Practicum Reflection 3. The purpose of this assignment was to interview a patient with a compromised health state and develop a plan of care including an evidence-based teaching plan and a theory-based plan for advocating from this patient. This one was part of the class Nursing 4620 Compromised Multiple Health States. The person that interviewed was a 47-year-old Caucasian school teacher who was admitted for the allogeneic bone marrow transplant. The plan of care goal for this patient was oriented towards achieving knowledge on infection prevention before she was discharged. I felt I met this learning outcome 100%. The second framework is lifespan and health continuum. There are two learning outcomes here. The first one is to support patient clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. The second one is evaluate patient-centered care for patients' clients across the lifespans based on common and complex health needs and compromise multiple health states when considering multiple determinants of health. I felt I met this outcome by the assignment of the class Nursing 4316, Comprehensive Health Assessment Documentation. The purpose of this assignment was by using the digital clinical experience from Shadow Health along with the required textbook was to apply therapeutic communication, relationship skills, and the use of evidence-based outcomes for health promotion, risk detection, and disease prevention across the lifespans when performing a comprehensive holistic health assessment. I felt I met this outcome at 96%. The third framework is the evidence-based practice and clinical reasoning. The baccalaureate degree learning outcome is synthesize clinical reasoning and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. I felt I met this learning outcome by two assignments, both of them part of the class Nursing 4540 Care of Communities. The first assignment was a project planning form and windshield survey. The purpose of this assignment was first to identify an at-risk special needs community aggregate and then collect assessment data on that community aggregate. The second assignment was the project teaching plan. The purpose was to develop a teaching plan that would help the at-risk aggregate I chose on my windshield survey to develop a more effective disaster preparedness plan. The at-risk special need community aggregate I chose to work with the people requiring hemodialysis who reside in the city of Jacksonville Beach. Hemodialysis Patients are especially vulnerable during a natural disaster because dialysis is a life-threatening, sustaining, and cannot simply be postponed. I felt I met this object at 94%. The next framework is the patient client centered care. The learning outcome is employee safe, effective, patient centered care using theories and evidence based findings in collaboration with patient clients and members of the interprofessional and interprofessional healthcare teams. This is also part of the undergraduate student handbook. I felt I made this learning outcome by two assignments. The first one was the formal APA philosophy paper of the class Nursing 4321 Nursing Theories. The purpose of this assignment was to explore my own philosophy and nursing practice using the knowledge gaining from the study of different nursing theories. Uh, on this assignment, I decided to use James Watson human theory carried, who closely relates to my personal nursing philosophy. I think her caring factors can be easily applied to my daily practice by practicing loving kindness daily while being truly present for each patient and their individual needs. The second assignment was the practical reflection 2, part of the class 4620 compromised multiple health state. And the purpose of this assignment was to interview a patient with a compromised health state and develop a plan of care based on current evidence. Uh, I decided to work with a patient also who was feeling stronger after we have a stem cell transplant, but upon assessment, this patient exhibited a small ulcer on her left cheek with a pain level of 4, describing the sensation as burning and constant. And then, after recognizing an oral assessment grading system, she developed a moderate oral damage with an oral mucositis grade of 2, according to the World Health Organization oral toxicity scale. Since the condition of stomatitis presented as ulcerations placed her at risk for sepsis and septicemia, I decided to do a care plan that I was oriented toward achieving an oral mucositis grade of 1, which is characterized by soreness with or without erythema and absence of ulcers. I felt I met this learning outcome at 100%. The other framework that we have is the professional roles. And the learning outcomes are to differentiate multiple role dimensions and practices with ethical, legal, and regulatory parameters when caring for patients, clients, as a member of the interprofessional and intraprofessional healthcare team, and also to demonstrate professional integrity, effective communication, active inquiry, and service to the community. I felt the assignments that made these learning outcomes were first the clinical application paper by the class Nursing 4550 Leader Management of the Healthcare System. The purpose of this assignment was to gain practice in organizing and managing a patient guideline or procedure revision in my clinical setting that was evidence-based as it relates to patient safety. Um, so in my clinic, we have a lot of therapies like chemotherapy and blood transfusion, and so these patients require to have a central line. So therefore, they are in high risk of collapses. So my project was oriented to improve a safety culture with patients at risk of collapse by improving compliance with chlorhexidine bathing. The second assignment is the Civic Pride and Diversity assignment, which the purpose was to help me to explore my personal values related to civic pride and respect for diversity. On this assignment, I have to identify a program that address civic needs and support diversity and inclusion of my workplace that I would like to interact with as part of my continued professional growth. So for this assignment, I volunteered to work with the Gabriel House of Care, which is located here in Florida, and they provide affordable, extended stay lodging and, and in a supporting environment for transplant patients and their caregivers. Now I have here my 5-year career plan. I would like to say something that is stated on the American Nurse Association, that it says the nurse owns the same duties to self as to others, including the responsibility to preserve integrity and safety, to maintain competence, and to continue personal and professional growth. I believe I will maintain patient safety and professional growth if by applying to certifications that are needed in my nursing practice. So to do so, my first goal is to do the chemotherapy immunotherapy certification course, which consists like more than 200 hours of certification courses. Is provided by Oncology Nursing Society. This one will allow me to my second career plan goal, which is be an oncology certified nurse. After that, I also want to train and do take the courses necessary to do and to become certified blood and blood and marrow transplant certified nurse. After that, I would like to be more involved on my unit and be part of the team leader department of the hematology oncology unit when I can explore more patient needs and staff needs with the main goal of be part of my year career care plan is to be part of the bone marrow transplant unit and be part of the coordinator for specialized patients, especially international patients. Well, thank you very much, and those are my reference.